Good afternoon, everyone. This is Madeline Perez with the Community Technical Assistance Center, and I would like to welcome you to today's webinar on new perspectives in death, dying, and grief. Today's webinar is the third and final of a three-part series entitled Working with Grief and Loss. Here are the steps needed in order to receive your continuing education credits for licensed social workers and licensed mental health counselors. You can receive one licensing contact hour after registering and paying the registration fee. Please note that within a few business days, these slides will become available to you so you can reference them in order to get those CE credits. This webinar has also been approved for one CASAC contact hour for continuing education. I will review these slides again at the end of the presentation. Before we get started, I want to take a moment to orient everyone to the WebEx system so you know how to participate in today's event. Please note that upon joining the webinar, you have been placed on mute to avoid any background noises that may distract others from listening to the presentation today. If you come across any technical issues during today's event, please chat to the host who will be able to assist you. You will have the opportunity to submit questions for the Q&A portion of today's presentation by utilizing the chat box feature, which is located on the right-hand side of your screen. If it is not visible, click the dialog bubble on the top right toolbar and it should appear. In order to ensure that we're able to answer as many questions as time permits, we are requesting that you send in your questions at any point during the webinar and we will address them during the Q&A portion of today's presentation. We are very excited to be joined by Dr. Kenneth Doka, a licensed mental health counselor and specialist on grief and loss. Once again, thank you for joining us. Before I pass it along to Dr. Doka to get us started, we have a discussion question. The discussion question: what therapeutic approach and or theory informs your work when working with clients who are dying or bereaved? We will give everyone a few moments to answer this question on the right-hand side within the chat box, as this information will be helpful moving forward with the presentation.
I wonder if we can move the slides back a few. Good morning, everybody, or good afternoon, I should say, everybody. I'm delighted to be presenting with you today. And what I'm going to be presenting on is really new perspectives on dying, death, and grief. And actually, we're sort of at an interesting time. 100 years ago, many of us credit is the beginning of the first study, really, the scientific study of grief and loss. I mean, obviously, you can go back to some of the most ancient work, and you'll see people reflecting on issues of mortality and morbidity and the like, as far back as most scriptures, the oldest scriptures of the oldest faiths, even the Gilgamesh epic. But it was 100 years ago that Freud really developed what has often been called the grief work hypothesis. And 100 years ago, he wrote an essay, interestingly enough, an issue that we're still struggling with, on how does depression differ from grief. He called it mourning and melancholia. And what he basically said was that as he began to typify grief, that one must work through painful feelings in order to detach from the deceased and reinvest in life. So basically, what he was talking about is the fact that you had invested feelings in someone, now deceased, and that your desire to retain a relationship with that person is now challenged by reality, and that grief work really involved detaching from the deceased and taking that energy that you had in that person and reinvesting it in others. Basically, the grief work hypothesis was never really fully accepted. People, throughout the years challenged it. It often coexisted with other approaches. And sometimes sometimes really, you might say, were continually challenged, and many of the statements that were made, particularly in the popular kinds of studies of grief, were often oversimplifications. So today what we want to look at is we want to look at 5 challenges to the grief paradigm. The application of new models, going beyond feeling, going beyond coping, going beyond detachment to seek continuing bonds, and extending the definition of loss. So to begin, probably most of you, when you think of your models of grief and loss, probably think of Kübler-Ross. It certainly is a starting point, and her work was very, very important and very, very significant. And Kübler-Ross, for example, talked about the famous stages of dying. Actually, it's interesting that her work never really talked about grief per se, but talked about the dying process. And of course, many of you know that Kübler-Ross said that first people go through denial, this is not happening, and then anger, why is this happening, and then bargaining, if I can live another few days, or if I want to live till my daughter's wedding, to finally depression, and then ultimately acceptance of it. And that model became applied to a lot of things, including the notion of grief. And of course, she always said that alongside of that model was hope. It's hard to believe that that model itself is almost 50 years old. And it certainly has retained a hold on popular culture. There are parodies of it in television, in movies, etc. Think of All That Jazz, and even a Simpson episode that talked about Homer Simpson going through these stages as only Homer Simpson would. But the problem with the stage model, or problems with the stage model, are many. I think one of the reasons it was so long-lasting is what a colleague of mine, Bob Neimeyer, talks about, is that it really kind of stretches that kind of epic model. And I don't know what's happening. I'm trying to get through these slides, and they're not going well. So maybe we can move to the next slide.
Sure, I'll take over. I can take over moving of the slides. So if you don't mind just saying next slide, then I can do that for you.
Thank you. So as we move to the next slide, what I was recounting of was that Bob Neimeyer talked about the fact that it was popular also among professionals for a lot of reasons. It really resonates with the whole epic structure of work, right back to the Gilgamesh epic, you know. A hero faces a problem, he struggles with it, he finally masters it. It allowed the medical management of the dying in the sense that, that people could often, they had a goal. You can move people from denial to acceptance. And Kübler-Ross herself was a very charismatic advocate. I've had the opportunity to hear her and meet her over the years, and it fit in well with the mood of the late 60s and early 70s. It kind of gave a message of natural birth and natural death at a time, when these were consonant with our theory. We certainly, as we move to the next slide, have to credit Kübler-Ross with a lot of things. Certainly, in many ways, she made the study of dying and death popular. Her work had tremendous heuristic value. It began a tremendous study of dying and death. She talked about the enduring legacies to communicate with persons who are dying, to be sensitive to their needs when often there was a conspiracy of silence around that. However, and I really would stress this, practice demands currency. And yet a relatively recent study showed that even among counselors and nurses, the stage theory is the most well-known and often used, especially by people who really don't really specialize in the field of grief and loss. And, and the question that I always ask, would you wish to be treated by an oncologist using the 1969, status of the day method. No, certainly 50 years later, we've learned a lot more about grief. And as we move on to the next slide, we can really stress that current grief theory really emphasizes that there are individual pathways to loss rather than universal stages. And that makes sense to us because if you think about it, here we are, very different people in very different situations, very different relationships, both in terms of who the person is to us and what our relationship was with that person, very different circumstances of death. We come from diverse cultures, genders, spirituality. To think that we're all going to respond at the end of life in a kind of universal set of stages really doesn't make much sense nowadays. And so as we look at, move to the next slide and look at what we've learned about grief and loss in the last 50 years, we come to a lot of different conclusions. We recognize that grief is manifested in many ways. Physically, many of us may feel symptoms of illness. For many people, grief may affect them physically. They may have physical pains and aches and all kinds of physical reactions. And when I teach my students, I often stress the fact that while these can commonly come from grief, they all should be checked out as well by physicians who understand that the person who's reporting these had a recent loss. But again, because of the high morbidity, particularly in older widows and widowers, and because of the fact that grief is very stressful, and that many lifestyle factors that particularly may be shared by older couples, we do want to make sure that people get physically checked. Emotionally, people have ranges of emotions, and there's a great deal of study now that talks about, all kinds of emotions, from anger and guilt to relief to sadness, all of these kinds of responses. We recognize that grief affects us cognitively. It affects how we think. We may just feel like we're going through motions. We may struggle with different kinds of cognitions. We may constantly think about the experience of loss. We have all kinds of reactions cognitively. As a matter of fact, one of the things I say about children in grief is that many of the cognitive manifestations of grief, the inability to be attentive, the lack of concentration, can mimic learning disabilities. So again, if you're working in a school system where a child is referred, you may want to do a loss inventory on that child to see if there are any significant losses in the house that occurred prior to these symptoms. It affects us behaviorally. Some avoid reminders, some seek reminders, some people cry, some people almost behave in a manic fashion, others withdraw. And it affects us spiritually. Some rediscover aspects of their faith, and some fall away from it. Next slide. And of course, it's a highly individual reaction. We all respond to grief in our own unique way. One of my colleagues talks about that grief is unique as fingerprints or snowflakes. Each of us has our own pattern of responses, so we need to assess how the individual is reacting. And as we move to the next slide, that assessment can involve a number of different components. We want to talk about the nature of the relationship. First of all, what kind of relationship was it? Was it a parent? Was it a child? What was the quality and the nature of that attachment? And we'll talk about some of the factors there in a few minutes. What were the circumstances of the loss? Was it a sudden loss? Was it a loss that followed a prolonged illness? And one of the things we learned is, in the early part of our research on grief over the last 50 years, we often ask questions such as, well, is it worse to lose somebody this way or that way? And the answer that we found out is it's different. Each loss, each type of loss carries its own characteristics. We want to look at the personality and history of the individual. And again, some of the danger signs there would be historical difficulties with issues of adjustment, previous depression, previous anxiety. All of those would suggest that the person may experience more complicated grief. We want to look at the family and the social support. And again, while I wouldn't ask this question in this way, I'd maybe talk about their family experiences, but the question we want to answer for ourselves is basically, what do I need to know about the client's spirituality or culture to work with that person effectively? We need to understand concurrent stresses that are going on. It's one thing to lose a child, for example. It's quite another thing if you've also lost your job or it's been a fire and you've lost your house at the same time. So what else is going on in the person's life? And then also, what is their general health and coping abilities? So these are all factors that are very, very significant. As we move on to the next slide, we see that some of the research on grief assessment really talks about, a number of really major predictors based on the evidence. Often, for example, if there was conflict in the relationship, if there was ambivalence in the relationship, high degrees of ambivalence, that's going to probably lead to complications, and as well as excessive dependency. Obviously, pre-existing conditions. And then, just you as a therapist, you're looking at this client, what's your gut feeling about how this person is coping and can cope? Just to give you some of the current research on the individuality and some of the new models that are out there, as we move to the new slide, we can see that, that in the study of widows, Bonanno and his associates found a number of reactions. Before that, I just want to talk about the fact that I often like to talk about the grief process as a roller coaster of reactions, where you have ups and downs and highs and lows, and we're going to see that's very, very consistent with one of the current models of grief in a minute. But as we continue with the pathways of grief, we see in the next slide, we see that Bonanno, for example, and his associates found many different patterns. And again, some people had a common grief pattern where there were relatively high levels of stress that leveled off. Some people were more resilient. Some people were more chronic. Some people suffered from chronic depression. Some were depressed, but over time improved. And again, while, we certainly can look at, this is just one piece of research, the point we're trying to make here is that there are a number of different ways that people respond. We certainly don't go through any set of preset stages. One of the most current models, as we see in the next slide, is the dual process model of coping with loss and bereavement. And Maggie Strobe and Henk Schut, two very well-regarded researchers and theorists in the Netherlands, talk about two basic processes that people struggle with. They oscillate, go back and forth with. One is dealing with loss, and the other is living a new life in the face of loss. It's illustrated, for example, to me by one of my clients who came in one day, and when I asked her how she was doing, she said, "I'm doing very well. For the first time since my husband died, I'm able to balance my checkbook," and and so you certainly saw her in that restoration phase. And then when she came back a week later, she talked about the fact that after she thought about that for a while, she thought if my husband were still alive, I wouldn't have to worry about this. That going back and forth, a very common process for the bereaved. And Strobe and Schut, over 17 years, have modified that model a little bit, and as we see in the next slide, really combined a number of other notions as they look at family coping. So they brought it to the family level. Strobe and Schutt are really one of 3 common models that are used now by grief therapists. And the other 2 we'll just briefly talk about in slides. And again, I'm very eclectic in going between these theories. So the next slide we talk about Neimeyer's approach, meaning reconstructive or a narrative approach to grief as we move to the next slide. And this one says that basically one must reintegrate the loss into one's sense of self and the world, either by assimilating that or moving on. And then probably one of the most common approaches to grief, one that I use a lot with counseling, although I've changed the wording of it and added an additional task, is the work of William Worden, who talks about the tasks of grief. And he says that the tasks of grief include acknowledge, and again, everybody does these tasks in different ways. These tasks are not linear, but what he's basically saying is there are common issues that arise in grief, and that basically what one has to do is complete these tasks, and everyone does this in a highly individual manner. So they have to acknowledge that the loss in fact happened, that they have to express whatever emotion the loss arouses, they have to adjust to a life that's now changed, they have to relocate the loss. This goes back to what we're going to talk about a little bit later on, which is basically the fact that that they have to retain, that we retain a continuing bond with the person that we've lost. And then, again, very compatible with what Neimeyer said is a task that I added. We have to reconstruct faith in philosophical systems that are challenged by losses. So, for instance, some losses may challenge our beliefs about the world, about God, what have you. And again, I find this probably one of the most useful models to include in my practice. As we move to the next slide, it kind of gives almost a protocol to the therapist, in that you can kind of see which tasks the person is struggling with. You can help identify the barriers to that kinds of tasks. It helps you structure interventions. And again, when I often am asked to evaluate people, or evaluate, I should say, grief groups or curricular, again, so many of them become just feeling-oriented. And what we really want to do is we really want to stress that grief reactions are not limited to feelings, and second of all, that feelings are only part of how one has to process grief. Again, the consensus of all these models is that it includes cognitive and behavioral work as well. And again, just to review again in the next slide, very, very briefly, we remember we respond to grief in all kinds of ways. And sometimes, Western counseling particularly can be, as Sue and Sue in their book on counseling the culturally diverse note, can be swallowed by affect. And I think one of the changes in our understanding of grief, as the next slide introduces the topic, is that we're moving beyond affect. And as we move beyond this slide, we can see some of the significant changes that have been made as we move beyond affect. And again, these changes include greater attention to the spiritual dimensions of loss, as Neimeyer talks about, loss as meaning reconstruction, that we have to say, what does my life mean now, now that I've had this loss. Tom Attig talks about relearning the world, that when a significant loss occurs, we have to essentially readjust and fix our process of understanding the world. To Attig, this can be as mundane as learning how to cook for one if you're a widower, but as profound if you're a widow, of learning to sleep alone or live alone if you've never lived alone before. And then some of the work that Terry Martin and I have done, Terry Martin's at Hood, has been on recognizing that many people process grief not in an intuitive or feeling way, but more by thinking and doing, and have developed sets of interventions that work with what we call these instrumental grievers, who sort of do their grief. Another thing we want to do is we want to move beyond coping. And as we look at the next slide, we want to move beyond coping, and what I mean by that is that we want to spend less time, or we want to acknowledge that much of our work has stressed how do people get through grief. And what we've learned is that there's more than that. And I have an illustration on our next slide. And this is one of my godchildren. I could never get my son to go caving, but I did get my godson to go caving with me. And we reached a very tricky, scary point in the cave as we were exploring a wild cave with a group of cavers that I was a member of many years ago. This boy is now close to 50 himself. And one of the things that he said as he decided to take the chance and go through essentially an underground stream for a few feet, totally submerged in a cave tunnel as he did that. And I commended him for his bravery, and one of the things he said to me after was, my dad always says there are moments in your life where you have a choice to grow up and to grow down. And in many ways, grief is one of those experiences. It changes us. And some of our newest work has really looked at that, particularly work by Calhoun and Tedeschi on what we call post-traumatic growth. As we move to the next slide, we can see that grief is really in many ways a transformative process. We have what I call Scott's choice. We can either grow up or grow down. Many people who have experienced a significant loss will say things like, I have a renewed sense of spirituality. My faith is deeper. Many of you may remember the work of C.S. Lewis, a Christian writer. And C.S. Lewis once wrote a book called The Problem of Pain, where he asked the fundamental question of why do we as humans have to suffer? And the answer he came up with was that we suffer. And he gave all these kinds of trite answers. Later, he suffered when his own wife died. He was a bachelor who had married late. He never expected the joy of family that he found. And he wrote a powerful book called A Grief Observed. And he once said after he wrote A Grief Observed, the problem with the problem of pain was that I had not really experienced pain when I wrote it. A Grief Observed is far more profound, and he makes statements. Now remember, this is a great Christian writer. Where is God when you really need him? A door slammed in your face. Later, he's able to say, it was my own frantic need that slammed that door. But his spirituality now becomes much richer, much deeper. He's able to understand that he doesn't understand everything, and he's fine with that. Other people will talk about a greater appreciation of life, relationships, priorities. I think about my field. I've been in the field for 46 years. And I think as I've lived at the edge of forever, as one of my grandchildren said, that one of the things I've learned is really to prioritize my relationships. I end my conversations with statements like, I miss you and I love you whenever I talk to people I care about. Other people will say, I've grown in character. I'm much stronger now. Other people will say, I have an existential awareness. I'm very aware of the fragility of life, and I want to nurture the moments I have. Other people will talk about growths and skills. I've learned to do things that I never did before. And others will talk about changes in lifestyle. When my dad died of lung cancer, for example, I stopped smoking, people will say. So Calhoun and Tedeschi really talk about the ways we can really grow up as we experience loss. And as counselors, as the next slide indicates, we can enhance that transformative process. We can do this in a number of ways. One is the language of survivorship. A number of years ago, I read a very powerful short essay by a social worker by the name of John Reynolds. And John Reynolds talks about the language of survivorship. How do we speak to our clients? And one of the things that I really took out of that is that after I read John's paper, I no longer had a widow or widowers group. I now had a group for surviving spouses. That seemed to emphasize survivorship, where widows and widowers tends to emphasize that you're a victim of something. Catherine Sanders, another therapist who died in around 2001, did some powerful and some of the formative research in the field of grief, used to talk about how her studies showed that people often made choices, pretty much like Scott's choice, to grow up or to grow down. And that ultimately they had what she called a turning point moment, where they had to decide whether they were going to continue their life as grieving or maybe just, consciously or unconsciously will death or choose to really grow. And I've always liked her work a great deal, and I've always felt that small choices empower bigger choices. So when I work with clients, I often ask them questions about choice. I often ask them questions like, as we approach the holidays, rather than how are you coping with the holidays, the question I might ask is, with whom do you choose to spend the holidays? What are you choosing to do during the holidays? Lots of times patients will tell me, my sister-in-law wants me to come over. And I'll say, is that who you choose to be with? But I'm trying to get patients to actively consider that they have choices in this field. Another thing that works is to examine their positive and negative adaptations. Often if somebody comes back from the Christmas or Hanukkah or New Year's holidays, Kwanzaa holidays, whatever holidays they celebrate this month, and they tell us as counselors that there's 4 things that went well and 1 that didn't, we often focus on the 1 that didn't. And my point would be that very often we can learn more by stressing the positive adaptations. We need to know what happened and what didn't work out, but we need to help them explore the strengths that help them get through certain things well. Sometimes it's the simple reflection. How has this loss changed you? And one of the things that research has shown is what we call benefit finding. And what we mean by benefit finding is that people can sometimes, they may not find any meaning as to why they're lost, why they experienced the loss they experienced, but they may find meaning in what happened as a result of it. Now, this has to be very, very carefully introduced, or else it sounds like you're singing, there's a bright side to everything to your clients. But the way that I introduce it is I often wait till I hear them say something like, well, because of this, I've become active in this group or that group. And then I'll say, that's interesting. Have there been any other ways that you have changed, anything you've noted? As we move to the next slide, John Schneider, in his work, talks about the fact that grieving individuals have to look backwards and forwards. They have to understand what is lost, and what we mean by that is, all the secondary losses. I remember once when my son was about 16, a client whose 19-year-old son said something that really sent chills down my body as a counselor. She said, not only did I lose my son, but I simultaneously lost all of his friends. And, and I thought about all the kids who were drinking my soda and playing basketball on our hoop and staying over with my son, and were part of my son's life, and by extension, part of my life. And just the thinking that all of a sudden, if anything happened to him, all those other people would vanish. We have to also look back on our strengths. both our internal strengths and our external strengths. But as the next slide shows, we also have to look forward. And looking forward, I think of 3 questions that Catherine Sanders would ask in her therapy. What do I need to bring from my old life into my new life? You know, maybe some of my optimism, maybe whatever it is. What do I need to leave behind? Maybe some of the anger or guilt. What do I need to add? So again, just to conclude this section with the next slide, we want, as we counsel people, not just to look at how they're coping, but we want to look at how they're changing and how grief is changing them. And studies show better that clients, both in group and in individual therapy, will do better when leaders have transformation rather than coping as a goal. Another significant change that has gone on in the field of grief counseling, as we move into the next slide, is continuing connections. Here we recognize that Freud sort of had it wrong. And as we move to the next slide, we can see that grief is not a time-bound process that ends in detachment. We never lose our relationship with somebody. Rather, I like to use the term the amelioration of grief, as we see in the next slide. And what that means, as we look at the amelioration of grief, is that most people with uncomplicated grief will say, over time, pain lessens. People function at similar, and as we just said, sometimes better levels than prior to the loss, but we never lose the connection. Grief still has a developmental aspect, and it may be years after, maybe, for example, when you're 20 years later, if you've lost your spouse, when your granddaughter walks up the aisle, and you realize, I wish my spouse were here to share this moment with me. In a sense, grief is a lifelong journey that never ends. In the next slide, we're reminded of some of the early work on this continuing bond by one of the authors of this concept, Dennis Klaas. And Dennis Klaas talked about the fact that, he studied parents who had the death of a child. And he said that parents carried what he called an inner representation of that child. And what he meant by that was that if a child died, for example, at 6 years old, you were very aware 10 years later that that child would be a junior in high school, that depending on where you live, he may or may not be, or she or may not, or may be getting a driver's license, and you'd actually carry an image of the child. And as the next slide shows, we retain lots of connections with the person. We stay connected, obviously, in our memories. We still retain memories of that person. We stay connected in our biography, who they are, where if you know me, you see parts of my mother in me and parts of my father, parts of my older siblings. We know the legacies and liabilities that we receive from them. I start off every day with a list by creating a list of things that I need to accomplish that day. My dad did that, and my son does it well. Legacies. The spiritual connections that we have. The spiritual connections that maybe whatever our spirituality is, we'll meet in another time, in another dimension, in heaven, however we look at that. And, of course, the extraordinary experiences that we have. And as the next slide shows, these extraordinary experiences can be lots of different things. This often is based on the work of Lou LeGrand and others, but it pointed out that many times bereaved people have a variety of experiences which reinforce a sense of connection with the person who died. They have a sense of the person's presence. They have a sense, experience of that person. Maybe smelling a smell they associate with that person, or maybe the woman who slept with her partner for 50 years will all of a sudden put her arm where that partner was. and all of a sudden they'll feel, wow, I kind of felt that person for a moment. Or maybe you're walking down the street and for a minute you see that person. It can be symbolic experiences. Lou Legrand says that he got involved in this field when a person, one of his clients, a mother whose 16-year-old son had died in a car crash, told him one day that before she stopped in his office, she passes the cemetery, and she always stopped at her son's grave. And this day, there was a hawk that was perched on the memorial stone. And it didn't fly away right away. It kind of cocked its head and looked at her and slowly flew off. And Dr. Legrand asked her, that has relevance to your son? She said, my son's nickname was Hawk. Others may have third-party experiences where somebody else says something that seems to remind them of the deceased. So, for example, when my mother died, my son was very close to his grandmother. One of the things that gave him comfort was the fact that he thought my mother and grandfather were together again. And one day a neighbor came over to him and said, my wife had the most remarkable dream, Michael. In that dream, she perceived that your mother and father were walking hand in hand down the street. And of course, dreams are very, very common too. Some what we call visitation dreams. These messages very, very clear. Others may be more symbolic. One of my clients whose mother died very suddenly talked about that she would have these dreams that she was in a plane and her mother went up to use the restroom, and it came time for people to return to their seats and the mother still hadn't returned, and she asked the flight attendant to look for her mother and in the restroom, and the mother said, there's nobody there, honey, both restrooms are empty. And and then she realized one of the techniques I used is I asked her to name the dream, and the name she chose for it was vanished in thin air. And she really realized that's her experience of a mother's death, healthy one day, and then a phone call that she's vanished into thin air, that she died suddenly. The last change that we want to talk about today, very, very briefly, as we move to the next slide, is extending the definition of grief. And here we really go back to Freud. And some of my work, and the next slide on disenfranchised grief, really has talked about all the different kinds of ways that we experience loss. Disenfranchised grief was a work that talked about a loss that can't be socially sanctioned, openly acknowledged, or publicly mourned. Here we sort of go back to Freud in many ways. It's interesting that his case in Mourning and Melancholia was not what you'd expect, a grieving parent, a grieving child, a grieving spouse, but a spouse left at the altar. And I think Freud was trying to remind us that grief is not about death. Grief is about loss. And we experience loss in all kinds of relationships, maybe with ex-spouses, maybe with people we never knew, like celebrities, maybe with other losses that have nothing to do with death. In fact, if you think about it, most transitions, however celebrated, often have a component of loss and grief in them. Think about your last day at college or your last day at high school, that graduation, when you realized as much as you were proud and as much as you look forward, that friendships and experiences that you had, you are now moving in on. So as we move to the next slide, one of the things I want to summarize is where contemporary grief theory is. And it acknowledges the variety of losses that engender grief. I wouldn't say it's even skeptical. It really dismisses the idea of a predictable set of stages. It really talks about personal pathways. It moves from just attention to the emotions of loss to the cognitive and spiritual aspects of grief. It no longer continues to talk about detachment or closure. I always tell my students, bring closure to the idea of closure, but we emphasize the continuing bonds that we still retain with people. We recognize post-traumatic growth. And I would say two other things that I really didn't talk about in this seminar, but certainly exist. We recognize that culture influences our reactions to grief, that different cultures recognize and acknowledge different losses, may express and experience grief differently. And then we recognize, because everyone grieves in a different way, that our approach to grieving clients has to be eclectic, evidence-based, but eclectic. And so as we move into the next slide, the challenge that I think we have to professionals is to remain current. It's a rapidly extending field, but remember, for many professionals, grief is a core competency. We really cannot be stuck in a model that's 50 years old. We have to expand our understandings of dying, grief, and loss. And I do want to make you aware of a couple of resources from the Hospice Foundation as we close this presentation, open questions and answers. One is a book, as we move to the next slide, called Beyond Kübler-Ross, New Perspectives on Dying, Death, and Grief. And again, you can order that from the Hospice Foundation, and you can just visit hospicefoundation.org and see that. And very similarly, a number of years ago, they did a more extensive program, actually beyond a webinar, a panel discussion in the next slide, about Beyond Kübler-Ross, which was a presentation with some of the leading theorists in the field about the way that things have changed. That's another way to get CEUs. So you want to be aware of those two resources. I'm really glad to have this opportunity to talk with you for the last 45 minutes or so, and I look forward to spending another 10 or 15 minutes really talking about your questions.
Thank you, Dr. Doka. We're now going to begin answering the questions submitted during today's presentation. As a reminder, you could still submit questions through the chat box. Our first question is, you mentioned the loss inventory when working with children. What other recommended assessments do you suggest?
Well, you know, I can't think of one right off the mind, and I wasn't really talking about a particular technique, but if you, there's lots of different measures out there, and I don't have a list in front of me, that measure ways to assess grief. The Sanders Grief Experience Inventory, the Texas Grief Inventory, you know, and what I meant primarily about a loss inventory there was just to ask the child, have you had any recent experiences, losses? How have things changed? You know, how is your household different? You know, it doesn't have to be a death. It could be the fact that you know, a partner or somebody has moved out. So again, but there are a number of instruments that are out there, complicated grief inventory, some of which have been adapted for children.
Okay, great. The next question, could the losses for children include a parent who leaves versus died?
Of course, yes. As a matter of fact, you know, some of the research has indicated that sometimes when a parent essentially not only divorces but really abandons the children, really doesn't see them or doesn't see them in any consistent way, is that the longer-term implications of that can be far worse. And I used to say tentatively the research is showing, but I don't even say tentatively anymore, that really essentially that feeling of being abandoned by a parent is in some of the research is showing has more long-term impacts than having a parent die.
Great. Do you feel there is a general length of time with grief where it then becomes an issue or complicated?
Well, it's a good question. You know, and again, I think there's a number of different ways to answer that question. Complicated grief is one of the major areas that we're really studying now and debating. What I tend to say is that, you know, if you take that roller coaster analogy, for most people over time, and time varies, sometimes it's a year, sometimes it's 2 years, I'm usually not worried in that period, but usually most people will say that over time, what you really have is, you know, to me the key questions are, you know, those lows in that roller coaster when you go down, or do they happen as often as they did a few months ago? Do they last as long? Are they intense? And I think if a person says a year and a half after the loss, yeah, there's been no improvement, that's a danger sign to me. I think the biggest danger sign to me is where over a period of time, maybe just even a couple of months, grief really, there's a term that Nancy Boyd Webb uses, which I really like. It's called disabling grief. That grief really becomes disabling, and after a few months of a significant loss, the person's really not functioning well. They're not functioning well at school, they're not functioning well at home, they're not functioning well at work. It's not an intermittent thing, it's a very regular thing, and that to me is one of the most profound signs that something is going on. Of course, another major sign is where the person engages in self-destructive or other destructive, you know, they really want to hurt somebody, you know, or they really want to hurt themselves, or they're engaging in self-destructive behaviors, you know, drinking, using illegal substances, all those kinds of things. So those are some clear danger signs.
Okay, thank you. When you say our approaches need to be evidence-based, would you recommend particular evidence-based practices for particular clients?
That's such a broad question. The answer, of course, is yes. And I think what you really need to do is look at some of the literature on this. You know, for instance, if you're working with children, the work of Sandler's group in the University of Arizona really talks about a number of different very effective approaches that have some evidence basis. You know, Catherine Shear at Columbia University has some evidence-based approaches for working with more complicated grief. There's a lot of approaches out there, and that do have an evidence basis. And the nice thing about the field of grief is there really has been a renaissance since Kübler-Ross. And that was one of the major contributions of Kübler-Ross, to get us thinking about these topics.
Okay. Is there a difference between grief and mourning?
Depends who you talk to. And we sometimes make a distinction in the field between actually grief, mourning, and bereavement, but it's not always consistent in everybody's writing. The distinction that I make is that bereavement refers to an objective situation of loss. If I lost my child, I am a bereaved parent. If I've lost my partner, I am a bereaved partner, bereaved spouse. You know, so it's just an objective condition. Grief would be the way we respond to that condition. You know, so, you know, my reactions, my responses, those would constitute what we would call grief. How do I respond to that loss? How do I react to that loss? Mourning has been used in two ways, both sort of interpersonal and intrapersonal. Interpersonally, it would refer to the rituals that we have around grief. So if I'm wearing black, by that definition, or wearing, you know, some kind of memorial button or something like that, that would be mourning behavior. Going to a funeral would be mourning behavior. Other people have used it in a more intrapsychic way as the process of working through grief. Other terms that are used in that regard, in terms that I'd prefer, but again, different people use, you know, as I said, it hasn't had a field of consistency, would be grieving or grief work. And again, the value of these distinctions is that it sometimes helps us to understand things. So for example, you may have deep grief to a divorce, but there really are no, from an interpersonal level, one of the things that we lack in divorce are really clear mourning rituals by which you act on and act out your grief. So, you know, there are distinctions, but they're not used consistently.
Okay. Do you have any recommended books or resources for a parent who lost her adult son tragically 3 years ago and is overwhelmed with grief?
Well, there are, you know, I'm going to be arrogant enough to suggest one of my books, which is Grief is a Journey, which talks about a wide variety of losses. Another book that I really like is Therese Rando's How to Go on Living When Somebody You Love Dies. That's R-A-N-D-O. And then my book, Doka, Grief is a Journey. They're both meant for popular audiences, and they're both relatively current with some of the newest research.
Okay, thank you. Do you think Manchester by the Sea was an accurate depiction of grief? How would you have intervened?
Okay, I'm going to pass on that question. One of my modes of self-care is that I tend not to see, I work with grieving people every day. I tend not to see movies about grief and loss because it just plunges me back into the life I want to escape, you know, at that point in time. So I've never seen Manchester by the Sea. Somebody once, when I was heavily involved in working with parents who had lost children, foster parents who had lost foster kids who were HIV positive, somebody gave me the movie on VHS of Philadelphia. When I was going through my videos, I still see it still in its plastic. I'm sure it's a great movie. I don't know when I'll watch it.
Okay. And our final question. I find that people who have lost a loved one, such as a spouse, seem to have a tendency to appropriate other loss into their grief. For example, 6 months ago my spouse died, now my neighbor down the street died. When will it end? Is there a reason for this, and what do you recommend when a client presents in this manner?
Give me that question again, please.
Yes. I find that people who have lost a loved one, such as a spouse, seem to have a tendency to appropriate other loss into their grief. For example, 6 months ago my spouse died, now my neighbor down the street died. When will it end? Is there a reason for this, and what do you recommend when a client presents in this manner?
Okay. Yeah, I think one of the things we have to look at is when we're assessing grief. And this is one of the problems that older people often have with grief. You know, if you say that grief is a process and it takes time, you know, especially when people get older in life, it's not unusual that losses cascade. And you may have a number of significant losses in a short time, and they do in fact complicate grief. You know, multiple losses is again another complicating factor. So, you know, what I would want to do is sort of, if I were with that client, explore what each loss meant to them. And it may have been that that neighbor was a confidant who she really dealt with when she was dealing with the loss of a spouse, and now this other person. You know, I want to understand the relationships, but I do want to recognize that when we do experience multiple losses, it does in fact complicate the grief process.
Okay. Again, thank you, Dr. Doka, for answering all of our questions and offering a great presentation on new perspectives in death, dying, and grief. And I'd like to thank everyone else for attending today's webinar.
And I'd like to add my thanks too.
Yeah, of course. Go ahead.
No, I just wanted to thank everybody.
Oh, okay, I'm sorry. Again, here are the steps needed in order to receive your continuing education credits. Within a few business days, these slides will become available to you. There's information here if you need additional assistance, so if you have any problems, feel free to reach out and we can offer you some assistance to make sure you get those CE credits. If you have any other questions, please contact us at ctac.info@nyu.edu. Once you leave today's webinar, you will receive a survey on the presentation, and we would appreciate if you would complete that survey and provide your feedback. On behalf of CTAC and our presenter, thank you for joining us, and enjoy the rest of your day.